Weissman 2005. Aim to study the potential genetic nature of major depression disorder. Method. A longitudinal family study was conducted with a sample of 161 grandchildren and their parents and grandparents. The study took place over a 20-year period, observing families with high and low risk for depression. The original sample of depressed patients, now grandparents, was selected from an outpatient clinic specializing in treating mood disorders. Non-depressed patients were selected from the same local community. The original sample of parents and children were interviewed 4 times during this period. The children were now adults and have children of their own. That allows for the study to continue for a 3rd generation. Clinicians who are blind to past diagnoses collect the data. Triangulation was used to establish credibility. Children were evaluated by 2 experienced clinicians, a child psychologist and a regular psychologist. Inter-rater reliability of diagnoses were 0.08 for MDD, 0.65 for anxiety disorders, and 0.94 for alcohol dependency. Results. The high rates of psychological disorders were found in the children with 2 generations of known MDD. By 12 years old, 59.2% of children showed signs of mental disorders, most commonly anxiety-related. An increased risk of any disorder was observed if depression was observed in both parents and grandparents compared to the other children. The severity of depression, parents' disorders, correlated increased rates of mood disorders in children. On the other hand, depressed patients without depressed grandparents showed no significant effect on the well-being of children. Conclusion. Grandparents and parents' MDD status modulates the children's MDD. Rates of disorders were highest in grandchildren, with parents and grandparents with a moderate to severely impairing depression. Anxiety disorders are the signs of early psychopathology in children.